Hi, I'm Dr. Ettie Ben-Shabat from Brain Rehab Academy, and in this video I want to talk with you about brain imaging and clinical reasoning. Over the past 4 months, I came across 3 similar cases where clinicians were using inadequate model of clinical reasoning, which meant the patient did not receive the treatment they needed. So what kind of clinical reasoning model did they use, and how could they have improved it? Let's dive deeper. All 3 cases had similar clinical presentation. There were some neurological symptoms that started, they would last for a few days, then there will be some degree of recovery, and after some time, new symptoms will start, or perhaps the same symptoms but slightly different. The clinical reasoning model that the clinicians were using is called pattern recognition. And the idea of this model is that clinicians rely on knowledge of symptoms and which conditions they match. So in this case, where the symptoms were varying in their nature over time, and sometimes there were symptoms and sometimes there were no symptoms, that type of inconsistency reminded the clinicians functional neurological disorder, and therefore that's how they treated the patients. However, when I looked at the brain imaging and used a different model of clinical reasoning, it became apparent that the problem is different and therefore a different treatment was required. What I saw was that there were several microbleeds in each one of those brains. And the location of the microbleed matched the symptoms they had. So for one person, it was dizziness. For another woman, it was hand weakness. The third woman was complaining about brain fog. So depending on where that bleed was, that determined the type of symptoms they had. Furthermore, because those bleeds were only small, they were microbleeds, the brain was able to recover from them relatively quickly. Within few days, the brain already compensated for those symptoms and those symptoms disappeared. This is the reason why they had different symptoms, because the bleeds were in different parts of the brain, and the symptoms sometimes were present and sometimes were not present, because when the microbleed was fresh, there was quite a lot of symptoms, but when the brain was given time to recover, the symptoms resolved. These cases highlight a really interesting point about using clinical reasoning models. If you use a particular clinical reasoning model, you might end up misdiagnosing a person. And if you use a different clinical reasoning model, you might identify what it is that the patient needs. So it becomes really important to choose the clinical reasoning model that is best for each case. Another interesting observation about these cases was that different clinicians use different models of clinical reasoning. So the different professions within the team were using clinical reasoning in a different way, which raises the question of how do we as a team, as a group of clinicians, each one from a different discipline, use clinical reasoning in a common way. And what I'm hoping that you're getting from this video is that brain imaging is that common ground, is that base where we can start having discussions, common discussions between different disciplines about clinical reasoning. If you enjoyed this video, please like, subscribe, and share. And if you want to learn more about brain imaging and clinical reasoning, join me for the upcoming seminar.